Let's see how many we have in the room. 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24. Are we good to divide into 5 groups, 4 each? Does that work? Okay. So let's do 1, 2, 3, 4. If you could be the insurance group. Okay. Insurance here. These 4 are insurance. Okay. 1, 2, 3, 4. Patients. Okay, you're patients. You'll join the 4 that are on the back. That will be hospitals. Is that okay? Then the 2 gentlemen that are speaking and not paying attention, and the 2 here, 1, 2, 3, 4. That's good. You'll be government. Is that okay? Is that okay, government? Government, 1, 2, 3, 4. And then we have 1, 2, 3, and the gentleman sitting in the front will be the pharma industry. Okay, so just try to sit there, and once you're physically together, I'll show you the 3 questions that I would like you to look at for the next 20 minutes. Rick and I will walk around. Yeah, do whatever you want, join whatever you want. So 4 here. Okay. So let me just make sure that we have everyone. So if you're in insurance, raise your hand. Who are insurance? Okay, 1, 2. Okay, 4, 5. Good, insurance. And then we have patients. We have, you guys are government? Pharma. And government is in the back. And doctors. Doctors, can you raise your hand? Hospitals, doctors? Great. Okay, please everybody sit down for a second. Make quick introductions. Why is it not going forward? I need to click. Like this? It's not working.
Let's move a little bit away so we can.
Okay, got it. It's good. Okay, so now that we're all settled in, thank you for being the brave. There's someone who's sitting on his own. Is he a rogue doctor? A rogue doctor. Okay, please join. He's a PhD probably. Okay, very good. And for those who are entering, just join each group randomly, and you will be notified which group you participate. You might get actually what you wanted. Okay, 3 questions that I will ask you, and that will be the topic of your discussion. Talk among yourselves what's not working. What's not working in your system? What's not good about being a doctor? What's not good about being a patient? What's not good about being pharma? What's not good? It doesn't matter if you know or you don't know. Doesn't matter. You can say, I don't know anything about anything, but just, okay? The second thing is, what would you change? I'll walk between you guys, so if you're stuck a little bit, I'll help you kind of jumpstart the thoughts. I'm getting these blank stares, so we'll jumpstart it. Don't worry. It works. I've done it with bankers, so it's good. It works. And then the last one is, what is value? Okay? What is value? Just talk about what do you think is value, okay? And we will, let's say it's 1:15 now. We'll do it until 1:40. We'll have time to talk in this. And 1:40, I'll pick it up, and, or no, we actually want each and every one of you to present. So we'll talk about until 1:30, and then I'll ask each group to present for a few minutes, and we'll talk, and we'll finish this by 2. Okay? Very good. Okay, so let's start. 5 more minutes. 5 more minutes. Decide who you want to be the person that will speak. Decide who you want the person to speak on your behalf. Another mic to give to number 2. Yep. Okay.
Generalist. Generally just consult.
Okay, very good. Conclude your thoughts. And let's start. Each one choose the one that you want to represent you. And let's start with the patients, because the patients are always the most important. If a representative from the patient group can please come and briefly share with the whole audience answers to these questions. So please, patients, one patient, and you have the floor for 5 minutes. Each one will have 5 minutes. That'll bring us close to 2, and then we'll have half an hour with Aman Qadri from AmChart. So please, patients, anyone speaking?
Just an interesting comment on ours and our patient group. We had a couple of MDs as well too.
That's fine, just one, if one can come, doesn't have to be an MD, but anyone, because everyone's waiting. Great. So please, let's turn around and pay attention. Okay, very good. So we have a lot of things. That's always good. We like active, so thank you so much for being so active. And again, pain points, what would you change and what is value? So go.
Okay, it's expensive. There's no price transparency. It's a hassle to obtain the right medical care. The user experience sucks, and it's difficult to navigate the system, get the right person. It's a complex system, especially for when you get older, and older people don't really understand the system either. We're very disease management focused, not preventative care. Mental health is a key gap area, as well as there are many gap areas. Health management issues, the wellness industry, like there's just no coordination between wellness and, there's not enough coordination with wellness and health management. Insurance is not paying for a lot of things that are just either you're discharged from the hospital and need something, and in the hospital it was paid for, and now outside it's not as an outpatient, and the patient still needs this care. It seems like there's just a lot of inventing problems with all these commercials that you hear and scare tactics. The whole low fat and non-fat, that's good, that's good stuff for you, just feeds for other industries to take advantage and start promoting other things to you that make you unhealthy and support the system. Environment where, okay, that was that, sorry. And special interests, just special interest groups seem to influence the care that we receive and that we give, and the just incentives are malaligned. A minority of patients make the medical decisions on their own, and not all those people have, that make those decisions with them have access to the same information, and they need that. When you're seeing lots of different doctors, there's just no holistic view of the patient. Even when you're within one hospital system versus, let alone if you're going from one hospital, a doctor who's affiliated with one hospital and another hospital, no way. And even with Epic now starting to share some electronic medical records, you're still not sure that you're seeing the whole picture. Not everyone's using it. The concept of so cost and expenses, there's just price piecemealing of costs and expenses, what's covered, what's not, it's bull. Price transparency, ratings, not really understanding how to find the best surgeon and what they're like. You can go on Yelp, but that's not really that trusted. And it just takes time to get an appointment, and the accessibility, oftentimes you're waiting in the waiting room for so much longer than you actually see your doctor, and you can't even get an appointment for 3 months out, and sometimes you never even meet the doctor, you're seeing a physician's assistant. And then just carelessness. You need an advocate. You're in a hospital and they have a list of drugs that you're taking, and they come in and it's like, no, I'm no longer taking that drug. Well, no, you need to take it. It's on the list. So that's our pain points.
Great. Well, we almost used, it sounded more like a Thanksgiving dinner, but thanks. Did you guys reach to talk, maybe you have another 30 seconds about value? Did that come up?
We want to feel empowered talking to the physician. Feeling like there's some connection between the wellness and allied health and medical, having doctors spend time with you, not being afraid to ask them questions. Those were...
Okay, excellent. Well, there's a bunch of angry patients. Very good, very good. Okay, so I always say for every angry patient, there's an angry doctor and angry hospital. So can we have the physician group or hospital group come over and tell us a little bit about your pain points? Come, because it's going to go fast. So use that 5 minutes. You have 3 minutes rant and 1 minute of value. So go. Well, we'll talk to the government. I'm sure the government will tell you what he thinks about you guys. Take that over there. Very good.
All right.
Okay, so now we're talking to MDs in hospitals. We didn't separate between doctors and hospitals, although we should. But because there are many employed now physicians, just for simplicity. So go ahead. Pain points.
All right, well, the first point, my group wanted me to make sure I mentioned that we're very angry also. So I'm going to stomp on the table a little bit. But yeah, so the pain points, I think, for hospitals and physicians, largely, a lot of things were discussed, but one is in terms of payments, the delays that obviously it takes sometimes to be paid, the lack of transparency and clarity around the cost of different procedures, and the reimbursement for those things can vary enormously. Oftentimes, the way that the hospitals are viewing it can also be very different than the ways that insurers or that even providers or physicians within the hospital. It can vary enormously between one institution and another, so that's a huge issue. There are a bunch of operational challenges in terms of the waiting queues. A lot of that has to do with the paperwork that is involved, to just everything related to getting patient identity verified, everything related to even just the waiting rooms in the ER. So another issue is related to data and transferring data between institutions. So if we come to one hospital here, transferring it from elsewhere, that can be very challenging. There are all sorts of restrictions on how that can happen, even within the states, but then let alone if you have patients who are coming and going from different countries, having different EHRs talk to one another is very difficult. And then another issue is just the access to different treatments, technologies, and then other things to provide for patients. So how do we change it, or how could blockchain potentially play a role in it? If you can have things intelligently using the blockchain, not trying to store big amounts of data on the blockchain, then maybe what you can do is remove certain barriers with smart contracts, reduce paperwork, facilitate things that the immutability can help with. I think, were you raising your hand? Or no? Okay. I thought someone wanted to contribute something. So that was one idea. Another area's changes could involve increased transparency. And another area would be like in supply chain, where you can increase make things more accessible and viewable for people along different aspects of the supply chain. So I think that's where some of the value that we thought can come in would be on using the immutability to kind of reduce costs and intelligently store data, not trying to put big x-rays and things like that on blockchain, which just won't work, but maybe using a private key or something to help access that information.
Excellent. So it sounded like a cathartic discussion. It's good.
Yeah, we're a little less angry now.
I'm sure we'll talk about this. I'll debrief the whole thing for 5 minutes, so we'll start on time with Aman, but I'm sure you can already hear words repeating themselves, right? Transparency, data, information. We're starting to hear the same thematics, and of course, being angry is part of also the common denominator. So that was very good. I think at this point, the next group would be the pharma group. Let's do pharma industry. They're really angry, but they're not going to say it. Okay, good.
We're never angry because we're always heavily medicated. Alrighty, so as our pain points, regulation, lobbying, it's expensive. We want that to be cheaper. We want to have more control over government and our drugs. Manufacturing is obviously an issue. Anytime that it's slow or inefficient, that's costing us a lot more money. Research and development is easily one of the biggest costs when it comes to pharmaceuticals. So if you can make that cheaper or better somehow, then that's going to be a huge benefit. And then obviously distribution is an issue as well. So what would we change? Obviously, and this kind of adds into the value. Anytime that you can create some sort of efficiency in the market or efficiency in distribution, that can be really helpful when it comes to intellectual property. If we can increase the control or increase the enforceability of our patents, that's going to be great for us, although maybe not as good for consumers. And then when it comes to personnel as well, anytime that you can either get great researchers or great salespeople on your team, that's going to really benefit.
Excellent. So clearly you're a little bit better off. Can you tell a little bit about what would you guys change? If there's between the choices, if there would be one thing that you'd feel kind of
patent extension.
Patent extension.
Yeah. Or enforceability when you go into new markets.
Okay. Very good.
Did you guys say counterfeiting? Was that one of your items too across the globe? So where you lose a lot of revenue?
Yeah.
Okay, so we got fraud. Okay, very good. So this is good. We're starting to hear that there might be different players with different optics. That's good. Let's talk now to the insurers. Let's hear the payers, those who have to support the whole system. So who's going to speak? Payers? Excellent. You have an extra minute because pharma was heavily medicated. So take the microphone over there and share with the group. Great job, by the way. I appreciate it.
Hey guys, my name is Jordette. So what are the pain points? Right now I think some of the biggest pain points for the insurance and really every industry out there is the profits before people. We're all focused on making as much money as we can, the bottom line, before we are fixing. I was telling my group that tomorrow actually I'm going in for an MRI on my right knee, and I asked them that if we could go ahead and get the left knee out of the way too, because I'm sensing the same early things there, and they're like, no. There's like a whole process. I'm like, well, can I go ahead and pay you those copays and get that out of the way? And no, that's not how it works. There's also no data flow between medical organizations, doctors, and patients. The lag times in every aspect of the process due to the needless complexities of everything is ridiculous. And also, we also talked about the loss of revenues to fraud and other things. That's some of the pain points that the insurance has to deal with. What would we change? First of all, I think we need to decentralize the whole process. That kind of removes or that fixes the profits before people. We need to eliminate the needless administration and complexity via the smart contracts. Remove the data silos so that there's more transparency between doctors, patients, insurance companies. Also, I think that we should globalize the health insurance system. There's state and nation solutions in place. David Metcalf, what's that one you're working with?
The health sharing ministry.
Yeah, the health share, and then you mentioned Oscar or something. That's here in the United States, is it? And there's other ones in Europe and stuff, but nobody that I know has told me about any kind of global solutions. I mean, we're all human beings on the planet. Wouldn't it be cool if we could all put in $100 a month, and that kind of covers any medical needs that we that come across? Internet of Things, wearables, ingestibles, kind of like the nanites that Kurzweil talks about. Ingest a capsule full of nanites, and it kind of goes through and monitors your whole system and fixes problems before it becomes an issue. That's kind of in the future, but right now we're dealing with like Apple Watch, the Fitbits and stuff, all that information in the cloud that kind of helps us out. What are the values? This just means better health and wellness for everyone. One of my favorite sayings is, everybody does better when everybody does better. And that's all I got.
Excellent. Well, thank you. And clearly you're a bunch of enlightened insurers. I'm not surprised John is amongst you, John and David. But I just wonder how many of these type of discussions happen among the payers. But it's exciting to see that these thoughts are out there. So again, you see some thematics that are common, some that are a little bit particular, and the last but not least, our loved administration. So anybody from the government would like to talk for 5 minutes, and we'll wrap this up. So please tell us as citizens, what are we doing wrong? How are you gonna, yes. Don't ask what I can do for you, but what you can do for me. Yes, Mr. President, thank you, please. Oh, yeah, you got the, over there, yes, please. And here.
Great. Well, as you know, we're the government. We have done nothing wrong, ever. But obviously the biggest issue is cost, right? We either need more money coming from you and your companies, or we need to reduce the cost, right? Which is neither one of those is attractive to people, but that is the world we live in. So what are some of the issues we want to talk about are CMS. I mean, obviously we know that CMS is offering more bundled services. This is a direction that we could be going in. Unfortunately, right now, the fee-for-pay system is leading to high costs, not to mention that a lot of the companies are merging. And are we, as a government, going to stop companies at a high level, insurance companies, from merging together? And because that's the free market. We want to keep the free market going. But at the same time, this is increasing costs. The fragmentation of medical providers is also an issue. Again, we want to be able to allow companies to do as they wish without, hindering their development, but at the same time, we recognize that this is imparting costs onto you. Another issue I think everyone was waiting for is education. Obviously, we, as the government, need to be educated. People need to talk to us, explain technology, explain what are your issues, where do your visions for your insurance platforms, for your distributed healthcare networks. Of course, for change, preventative health. What can we do to help make people healthy before they go to the hospital? Healthcare doesn't necessarily start in the hospital, right? It starts in the streets. It starts with affordable housing. It starts with nutrition. It starts with education. making sure kids get to school, get fed. And of course, value, providing healthcare. We provide, and eventually we're the ones who are responsible for the healthcare that's actually provided. So when we talk about wearables, when we talk about ingestibles, fantastic. But in the end, we have to have a privacy framework that is reliable. You know, we're slow moving, we're slow to act. And that's because we want to make sure that we're protected. So although there are some fantastic technologies that exist, we want to make sure that there's the appropriate privacy and safety of our citizens before we just have a wide implementation of fantastic yet thoroughly untested technology.
All right, so everyone, please be healthy, don't be stressed, and pray for government and for each other. Thank you.
Great.